We're going to fast forward in this presentation and really get into the nitty-gritty and get into actually that time of life where we're trying to transition from school to adult life, to a world with child's own apartment, so they're connected socially to other adults in the community, so they have a purpose, hopefully so they have some type of employment, maybe become married and start families of their own. So the question is, how do we pave that path for children with this deletion? And how do we set up the supports that they need in a productive way so that they are productive adults in society? So I want to bring us back to the research study that I talked about earlier that was done in Canada. It was a wonderful study, and it was very helpful to me as an advocate for families with this syndrome to have a published research paper on this. This study looked at 100 Canadian adults. They were average age of 28. 57 were average to borderline intellect, so it was kind of evenly, slightly more were average intellect. 43 were in the mildly intellectually impaired range. And an important thing about this study is that they were ascertained, the subjects for this study were ascertained from different clinics, not just psychiatric clinics. So some of these adults were ascertained from the cardiac clinic, some were from the genetics clinic, and some were from the psychiatric clinic. So it was a wide spectrum of adults with this syndrome. As I said earlier, 75% of these adults were functionally deficient, even despite their higher IQ levels, including half of the higher functioning individuals. Those adults that had more positive mental health outcomes, and I know many families are very worried about the mental health aspect of this syndrome, but it's not surprising to understand that those that didn't have complicated mental health histories were doing better. There were 18% of that population were married. About a quarter of them drove a car. About 1/5 of them had kids. 21% had children. 17% were able to totally support themselves, that they were integrated into society in the fullest way without needing any support. Half of them lived at home or with a relative. 61% of that population were receiving Canadian government assistance, and I'm not really sure what the criteria is for the Canada help, including almost 50% of those with higher IQs were receiving government assistance. Of the measurable outcomes, socialization and communication were the most troubling. Those were the areas that they had the most difficulty with. But as I said earlier, many of them worked, and many of them had a good mastery of just the basic skills for everyday life. There was also another study that was done as a part of this consortium that was 15 sites around the globe. There were 1,400 participants. The age ranges were 6 to 68. And what I was most interested in this study is taking a look again at my purpose for this talk today, which is more this adaptive skills and what these adults need. And anxiety disorders in this population also were associated with poor daily living skills. And functional skills in this group, which is a much larger group than we had in Canada, were also 2 standard deviation levels below the mean. Psychiatric disorders were prevalent at 43% of those over 25. However, most studies put that at about a quarter of the adults had mental health. However, I will say that a lot of that's treatable. So I don't want to scare people sitting here that think, oh my God, this is the end of the world. That's not the case. So, this could be mild anxiety. You're not really sure how the questionnaire is here of what they're talking about. But psychiatric issues are part of the syndrome in many cases in some respect. And that does impact a person's ability to function both on the job and in everyday life as adult. There is another study that I think is really pertinent to all of you, which is a study on caregivers of adults with this syndrome. There were 59 adult caregivers, 20 adult patients, and they responded to a survey on medical care, social services, perceived burden, and major challenges. And really a high number of caregivers felt the burden of care was high, 70%, as did 43% of the patients. And there was a lot of dissatisfaction with medical and social services for adults with the syndrome. So I think that based on these 3 studies, it's really imperative that as a community, as a 22Q community, that we really start pounding the drum about how we are going to do a better job at this. Many adults are in the community. They have not acquired the functional skills they need. Many adults with this are home with family. They're not independent. They don't have lives. And there's not a really good system of assisting them. We're going to change that. And we're going to talk about a lot of things that we can do to make the system better. First of all, it is necessary to plan. And it really is necessary to be proactive and to do direct intervention. It isn't something that's just going to happen because the kids get older. This is something that really the schools need to be involved with, the clinicians need to be involved with. And I think you as parents are going to have to be strong advocates in order to convince school systems of the need for services for those kids that don't have IQs below 70. That seems to be kind of the magic number. And if children are not in the very severe range of impairment, oftentimes school districts boot them out the door when they turn age 18. Glad to have you, have a nice life. And then the burden falls on the family. And the question is, what do we do then? It's better to try to get these supports in place early than to try to do so retrospectively. So in other words, it's better to really plan for the fact that there may be support that's needed in the adult life. And it's better to plan for that while the child is still in school than to go back when they're in their 20s and try to get services at that time. So what kinds of prongs do we need to put the system in place? There's several aspects. We need the schools to get on board with good transition plans and IEP planning and work experiences and programs for children that are in place until they're age 22 if they need it. Government support so that the government understands the challenges that are so strong with this syndrome and why children and young adults with this need the support that they do. We need to put in place your financial planning, your family planning, how you're going to support your child. And that's a whole other talk of family planning and how you get your finances in place so that you have a system to support your child. And then, of course, the child themselves. They're adults at age 18, and they have to be an integral part of whatever plans are put in place for what they're going to do when they're done with school. So what is the school's responsibility? Well, schools have the responsibility to plan for transition. Once a child turns 14 years of age, they have to have some kind of plan for after school. I've seen horrendous transition plans written for kids with this syndromes, absolutely horrendous. I've seen plans that have said they've asked the child, what are you going to do when you are done with school? And the child says, I want to be an astronaut, and that's written into the IEP. And I'm reading this and I'm thinking, what planet are you on to write an IEP like this for a child that has so many needs? So the transition planning it's a complex process. It has to have a lot of different aspects to it. And a lot of things that we've already touched on, the functional skills and so on. If a child graduates at age 18, in most states, and not all states, but this varies in some states of the country, Texas being one state that I learned is different. And I'm not sure exactly about California, but my impression is that when you graduate at 18, the school is basically done. You're done with, is that correct in California? Because I was surprised in Texas that they can come back on the IEP after age 18 if they graduate, which I had not heard. So the transition programs through the school system can be creative, and they are supposed to meet the unique needs of the kids with 22q that do not fit into their model. It's not the model that they're used to for providing these transition plans. But oftentimes, children with this syndrome need a plan. Schools have likely never put a plan together for a program or a program for a young adult with this syndrome. They may have something that they've packaged for kids with Down syndrome. They know what to do with that group, or autism maybe, but for kids that are higher functioning, there is often a real gap in what they offer. And usually it's nothing at all. They just figure you're going to make it on your own. So what should that transition plan look like? Well, we have a tier of functional skills. We have work experience, actual either volunteer experience or work in the community to get a work history with actual on-the-job experiences that can be documented. We can do job coaching and so on. And this can be done through a school program. There is the academics, and I'm talking about academics for job success. So what skills, by the time you get to high school level, what academics are really necessary for your adult life. I don't know about you, but I don't need to find the cosine of an angle and a right angle. That's not something that I need in my everyday life. What I do need to understand, though, is if I go to a store and something's on sale for 60% off, it's a good buy, and maybe I should get it. My husband may not think I should get it, but, I think I should get it. So they have to understand that. They have to understand time constraints. They have to understand money. How to budget, if they're only making so much money, if they're only bringing home, say, $1,000 a month, they can't live in an apartment that costs $1,200 a month. It's all of those functional skills that are, embedded in academics. And then there's that social skills component. It's getting along, having friends in the community, having a network, having people to go out with in the evenings, having friends to go to see a movie. Are they connected in the community? We don't want them home playing video games in the basement. Unless it's Tony's video game, then it's okay. But otherwise, we don't want them home by themselves without a life. So it's all of that social connectedness. And I think another tier here that I could have added is the communication part of this. Because again, we looked at some of the studies that have said that communication is a deficit area. And that's pragmatic, practical communication. Now, earlier, I talked about activities of daily living. And I said to you that most children with this syndrome really do master those activities of daily living. But there's a second tier of activities of daily living called the instrumental activities of daily living. These are things like managing finances, handling transportation, in other words, driving or navigating through the public transit, shopping, preparing meals, using the telephone and other communication devices to advocate, to find things, to make contacts with people, managing their medications safely, being able to be in a house, do all the housework, keep stuff picked up, having the house safe, shoveling correctly, getting the garbage out on the right day, all those things. These are the skills that kids with 22q have trouble with as adults. It's not that first tier of activities of daily living, it's the second tier of all of these things that seem to need some extra training. These are not usually covered with higher functioning kids in a school setting. These are usually covered in life skills classes, which are usually children that have more severe cognitive impairments, but in this population, those skills need to be covered. So there's a mismatch between what's offered and what's needed. There are safety concerns, internet usage, poor, real life experiences, poor cognition as far as consequences, not really getting it. Purchasing items, maintaining social relationships, all these things, physical health. How do you make doctor's appointments, keep the appointments? And if you go to the doctor appointment and the doctor tells you something, do you understand what the doctor said? So can you actually do what they told you to do for your back that you pulled out? What did they say? Do you need somebody there with you at these appointments? Are your bills getting paid on time? Who's overseeing that? Are you keeping the commitments that you made? Are you paying things? Are you getting to work on time? All of that. These are the functional skills that school programs can work on, and also community supports if children get into or are graduated into supports like what I believe it's the regional center in California, or some of your supports for the more adult community. Those are the kinds of things that there's help for out there. And in Wisconsin, at least, there are agencies that provide these services to adults in the community with disabilities. So how we access that is important, but we want to do the best we can to train the kids to do those things independently. Academics should be obviously the math and literacy remediation, academics needed for the job, money management, reading, writing, the ability to fill out job applications, to do the paperwork with enough details to be able to communicate on a job interview, let's say, functional skills in that area, and then general information. I think it's important for kids with this syndrome to be able to be a law-abiding citizen, to understand government, would hope that they would have an opinion, and I hate to say it about the election coming up. I don't want to depress anybody about what's coming up next week. But, all of those things are important as far as being a citizen. You want to have a full life. These kids need to have that general knowledge and how to access those things. And that's all topics for schools. These things can be taught in school classes. Social skills. Many adults with this syndrome, young adults, need therapy to focus on pragmatics and how to carry on a conversation, how to listen and get details, initiating invitations to friends, learning how to be a loyal friend. Kids with this syndrome sometimes have trouble with that. They misinterpret intentions of others. So trying to help them process through some of that. Social opportunities for them. Can they volunteer in the community? Can they be involved in a religious pursuit? Can we be connected somewhere? Are they going to a workout? Is there an exercise area they can go to? What are they going to do? We want them out of the house and we want them connected. They can volunteer, they can join interest groups, they can take a high interest class. I think it's important that we limit the amount of video games and isolation, the being on their own by themselves and in their own world. We want them out and connected. So the only way to accomplish that is really to get them out of the house and get them out of the house in meaningful ways. Now, work experience, a lot of parents ask, well, what can my child do? What kind of job can they possibly do? There are departments in the government system that are supposed to help you figure out what your child can do. In Wisconsin, it's the Department of Vocational Rehabilitation. I'm not sure exactly what it's called in California, but this is a branch of the government. Their job is to do job testing, to try to figure out possible employment avenues. In Wisconsin, I know our son was sent to Stevens Point, the University of Wisconsin Stevens Point, for 4 days. And he was put through a lot of different job options at that assessment. It lasted 4 days. He came out with a full report of his performance on those jobs and a set of recommendations for a transition plan. So I would connect with agencies in your area. The school system should be connecting you to the Department of Vocational Rehab. You should be securing a record of work attempts. Give the experience and try to take data. How did they do? Were they fired from the job? Was the employer complaining? Were they unable to show up? What was the job that they had, and what was the experience in the environment? Job behavior needs to be taught. What is expected job behavior? And how do we get along with our coworkers? So, appropriate dress for the job, be on time, call in sick in a timely manner. These are all things. Manage your emotion on the job. How much attention and pace is needed. How to ask for assistance. Are they able to work full-time or part-time? Should the employer know that they have 22Q11? Do we tell the employer? What do we think? What is the role of a job coach? These are all really good questions. When you move into the world of work, it's different than school. The employer is there to make money. They may have a good heart. They may really like helping people with disabilities. But the bottom line is they have a job to do. They have a business to run. And we want to prepare the kids to be able to at least be integrated into the world of work in a positive way so that their employers, and I will tell you, many adults with this syndrome make good employees. Just like they're good students, they go to work on time. They don't call in sick. They try their best. There are a lot of good aspects to what they bring to a job. But where they fall down is maybe their pace is slower, so they're not doing things fast enough. The detail to the job is not as good, so attention to detail may fall down. They may have interactions with coworker problems. There are places that things fall down on the job, but most kids with this syndrome really want to work. So government support is another prong here. Social Security, there are two prongs of Social Security. There's SSI, which is for people that don't have funding or funds and have never worked, basically, that don't have a work history. And there's something called SSDI, which allows you, for SSDI, you have to have a work record. You have to have years of work where you pay into the system, and then you can get funding out of SSDI. And sometimes if you have SSI to start and you work enough hours over a certain period of years, eventually you get off of the SSI program and you can get into SSDI. Social Security income, the application for that can be at age 18, and you would probably want to get ready to do this before age 18, start getting all this documentation together at age 17. The parent's income does not count when the child is 18. To apply for SSI for children with disabilities before that time, they look at your parent's income. So a lot of times kids don't qualify because their parents make too much money. But at age 18, that income doesn't count any longer. However, the child cannot have more than $2,000 in assets. So if you have savings accounts for your child, if there are bonds, they look at all of that, and your child will be disqualified if they have more than $2,000. So that's something to keep in mind for the SSI application. Social Security disability income requires a work history of payment. There's no asset limit. In other words, there isn't that $2,000 limit of what you can have. However, there is a certain amount of money that you can earn, and if you go beyond that threshold, you don't get your benefit anymore. I believe right now it's about $1,100 a month that you can bring in income, and then beyond that, your SSDI stops. So before that point, you can get both sources of both your income and the SSDI. The Department of Vocational Rehabilitation can do job coaching, training, education, and vocational testing. There's also the state agencies of developmental disabilities, which occur in every state. In Wisconsin, that agency can do things like home safety training, work assistance, they can do help with housing, they can help with job coaching, they can help with case management. So those are services. And in Wisconsin, every adult with a disability gets an amount of money, and then we have a system of self-determination, so we can hire who we want to provide the services. It's sort of out of a pool of money. And the community programs are depending on the level of need. So some people may get a lot of job coaching, some people may not get much at all. It depends on what the need is. So SSI applications. Having 22Q11.2 does not automatically qualify a young adult for benefits. Just having this diagnosis is not enough. You have to supply evidence of the disability. Doctors, therapists, vocational counselors, and school records. They don't want to know what grandma says about your child. This has to be documented, impartial, and preferably medical PhD level letters. Here's what you need to include in the SSI application. You need a medical history and a diagnosis, which you all have. 22q11 deletion, you have a medical history, you have the medical issues that are associated with the syndrome. Any clinical or lab findings, such as the results of a physical exam, a heart defects, mental status tests, cognitive tests, neuropsychological tests. These are the tests you need to have. What has been the treatment that your child has had? Have they been in therapy? What's been the response? Are they on medication? These are all the things that Social Security wants to know. They want to know whether or not your child can work and do despite their challenges. And that's where the job history, remember I told you to get some job history in school? You want to have a little bit of history there to show what kind of issues came up if issues came up on the job. Social Security wants to know your child's ability to perform work-related activities, such as sitting for long periods of time, standing, walking, carrying, handling objects, hearing, speaking, traveling from one place to another. Many children with this syndrome have hypotonia, they have low muscle tones, they have scoliosis, they have issues that would prevent them, manual dexterity issues. These are all things that will impact their ability to do certain jobs, and all of that needs to be documented. And then there's a last one that I think is very, very pertinent to this population. A claimant's capacity to understand, to carry out and remember instructions, and to respond appropriately to supervision, coworkers, and work pressures in a work setting. So if they're getting a lot of support at school to function, think of school as a work setting. And if they're having a lot of trouble navigating that environment, if they need a lot of people picking up after them, helping them collect their materials, helping them do things, getting assignments in on time, that's pertinent information for Social Security. That shows that they are going to have trouble carrying out those complex tasks in a work setting. So how does Social Security decide whether or not a person is disabled? Well, what they do is they use a list of qualifying impairments and specific guidelines. So there is, and this is online, and you can access this through this link. So understanding the need. First of all, whoever is looking at your child's application probably has never heard of this syndrome, and they do not understand the complexity of it. Underneath the neurological disorder, this is what is written there. The neurological or cognitive disorder must result in a marked limitation in physical functioning. And a really, what does this mean? But it's a big limitation. This isn't a little thing in at least one of the 4 areas of mental functioning. So understanding, remembering or applying information, interacting with others, concentrating, persisting, maintaining pace, or adapting and managing oneself. This is what needs to be in the documentation that you have to provide, and it needs to be a medical professional that is providing your child's difficulty in these areas if they have that difficulty. And many, many adults with this syndrome have these problems. It's very difficult for them. What I see as the 22q11 issues that are most compelling is the fact that it is a congenital disorder. The children have multiple problems that are impacting them. It's not just one thing. It's a lot of things. Many of them are very close to the cutoff for intellectual disability. They have learning impairments. Many of them have mental health impairments, especially anxiety, personality disorder, or attention deficit disorder. Communication problems with their speech and language impairments and so on. Physical challenges. Low muscle tone is a problem on a work site because they just tire easily. Some of them have thyroid issues, heart problems. Social impairment, interacting with others on the job, maybe with the public, may be hard for them. And difficulty with attention to task, doing things fast enough at the work environment to make money for the employer. This is a big list. It's not just one thing. And Social Security needs to understand the complexity of this disorder. It's not just one small issue. I wanted to speak a little bit about the IQ level, because this is just so hard. To get a cognitive impairment or intellectual disability, you have to have a valid performance or full-scale IQ of 60 through 70, and a physical or mental impairment imposing an additional and significant work-related limitation of function. So let's say you have a child with an IQ of 69, but they're in college, everything's fine, they don't have that second piece of this. They also have to have issues with daily living issues, difficulty with their social interaction. Have they been seeing a therapist? Is there anxiety medications that they're taking? Is there trouble with attention? Do they have any other issue on top of that? So you can see when I show you this, that this application for Social Security oftentimes is not a slam dunk for this population. The mental health example, I had a few slides with this because a lot of kids with this syndrome do have a mental health component here. And the level for impairment here for Part A of a personality disorder, and the list is here, you have to have at least one of these issues, and you guys can read up on the screen what these are. So one, that a therapist will document, not just mom or dad saying, but this has to be therapeutic interventions and a therapist documenting. And Part B of this requirement is some of these other restrictions of daily living that were on the previous slide. So How do you apply for this? Because this is overwhelming for a lot of families to get all this documentation together. You need to gather your documentation from approved sources. Go to the doctors, go to your pediatric doctor, go to the therapist, go to the school, go to your speech and language pathologist, go to your OT, PT, speech, I said speech. Get a current neuropsych evaluation. What I have found in my experience with a lot of families is that the IQ level gets very close to 70 in a lot of kids when they're reaching this 18 years of age. There seems to be, and Tony said this very well to me last night at dinner, their IQ stays here and the testing requirements continue to go up with more complex information. So their scores resemble more of what we would say the intellectual disability range. You need to include articles about 22q11 deletion, and I would be happy to help you with that. I would also be happy to help you draft a letter to Social Security about how the syndrome impacts your child, pulling together all of the aspects that Social Security is asking for and documenting how the medical reports that you have support your claims that your child has attention issues. In other words, my child was diagnosed with attention deficit disorder. They've had a lot of trouble with this since grade school. They've had interventions at school, and on so-and-so neuropsychological testing that was done, here is the score that shows that they were significantly impaired and they were diagnosed with attention deficit disorder. See Dr. Simon's report dated whatever date. You have to document everything with clinical support. And this is why really the Mind Institute and the medical professionals are so, so important in this process, because we need that documentation. Work with the school to support you in a transition program, and have the doctors and therapists explain in the letter that they're writing why your child can't work, and base their letter on what the Social Security requirements are. So they need to say in the letter, if they believe this, I'm not saying to falsify any information, but if they truly believe that all these things together present a picture of somebody who's really going to need help, they need to say that explicitly in the letter, and that's what you send to Social Security. You need to gather additional supportive documents. If you're turned down, ask to see the file that they use. Sometimes they do their own evaluations. You want to see what their people wrote on their file if you're turned down. You can file for reconsideration. Be sure to do so within the time limit that you're given. And then if you can't, even at that point, you need to consult an attorney that specializes in Social Security litigation. And many of them will do that on a contingency fee basis, that if you get benefits, that they take a piece of the benefits for a period of time or something. But you have to have an attorney supporting you in the process at that point. I think it's important to have realistic expectations for your young adult. Stress reduction, trust funds, consult an attorney again, guidance and physical presence to support your child, assistance with job applications, medical supervision, support with managing their finances. And I think the reality for families is your child is most likely going to need some level of monetary support for a long time. Most adults with this are not able to live just on their income. And even if they get Social Security, it's not enough to make it. I think there's additional issues about driving safety and cars, dating and marriage, decisions about having kids, which is a whole other discussion that we could have at some point, drugs and alcohol. I was so thankful to a doctor that told my son, you absolutely cannot drink. Based on the medications that you're taking, don't drink. So, I think it's important hearing that from a medical professional, saying that alcohol and some of these medications don't work well together. Support for mental health, find a therapist if your child is struggling, don't just ignore the symptoms, and then help for ongoing medical needs and mentoring of choices. So I think the importance is for you to know is that your role of the parent really doesn't end. You know, for older children with this, you're going to need to be involved in that child's life forever, and I know you would want to be there anyway, regardless of if your child has 22q or not. But learning does continue. It takes a slower trajectory with this syndrome. But there's a lot of growth that can occur in the 20s and in the early 30s. Be patient. You have to probably be somewhat assertive to boot the kids out of the house if they don't want to try things. You have to really work with them. Make plans for how your young adult with the syndrome will be supported financially in the future with estate planning. Seek professional help to help you and help your young adult. And I think it's really important that you take good care of yourself and the rest of your family. And I had this photograph that I took at a wonderful Pope family farm in Madison, Wisconsin, and I saw this one sunflower that was faced in another direction. All the other sunflowers were going the other way. And I just say, find your own sunshine for your child with this syndrome. And I have resources here again, and a big thank you to you for inviting me here today. So thank you.
At what age did your son actually go and have that evaluation, that 4-day evaluation done at the university?
Right, I think he was about 16 or 17 years old. I don't think the Department of Vocational Rehab will really want to see the children before that age. So they're looking at, you know, getting ready to graduate and plan for future employment.
Clinical support, you said, when you're doing all your documentation for Social Security. We're in the middle of a nightmare trying to get it for our 27-year-old. And one of the issues this particular judge is harping on is the fact that a lot of the documentations are coming from studies, not clinical assessments. And he's having an issue with that. So that, I think, is important to remember.
Yeah.
It's the clinical
And I'll
side
touch
of
on that because you want a treatment record. So, you know, if you're saying in the application that your child has anxiety, for example, you know, you're going to want a treatment record with a therapist that's been treating your child for anxiety, and you're going to want to show that, you know, they've tried things and it's a stressful environment and they've, you know, broken down in that environment. They've had to have things removed, you know, the stressors removed. So they want to see a history of this. They don't want just the word anxiety. You have to show that this rises to a level of a problem that's going to impede their ability to work.
the IQ portion, the IQ study portion.
Mm-hmm.
And that part is what he's having an issue with.
Right, and so it would be, for example, you know, documentation in a work study that they've tried on the job stuff and it broke down. They've had IQ tests that have showed the cognitive impairment. They were in special education in school. You know, they had all kinds of special training. It's hard to train them on the job. You know, these are all things that fall under the intellectual disability category that it's hard to learn. So you put the adults with this in a work environment, you know, many of them can't problem solve, that, you know, they need a job where they're sort of delegated responsibility and that they break down with a lot of stressors and a lot of pressure. So those kinds of things are impairing. It's hard to find a full-time job that works well. So, you know, you have to have the documentation. So you have to go to your medical clinics. You have to get the doctors to understand your child and work with your family over a period of time so that it's not you walking into the office a month before they turn 18 and saying, can you write a letter for Social Security for my child? Well, you know, they don't know your child. If this person has been treating them for several years, they have a whole list of clinical records. And they're a big asset to making an argument that, you know, this isn't just a minor problem, that it rises to a level of a more significant problem. So I guess the advice would be that don't ignore symptoms. You know, by getting the help in the medical community and going and, you know, setting your child up with a therapist if they need it, you know, you're giving that trail of competent notes, you're giving the trail that you can then have that documentation if in fact, you know, you choose to apply at age 18 for benefits. And, you know, I want to say as well about graduation at age 18. You know, this is a big stickler for this. You graduate your child at age 18. Under the IDEA law, the school district is required to give services until a child turns age 22. Oftentimes, kids with this syndrome that are slightly higher functioning are basically booted out the door and graduated at age 18 without any of the skills they need to live successfully on their own. So I really caution parents about allowing the district to graduate your child at age 18 if they're not ready to move on. And I think there could be a fight. That was the period in our life when we fought with the school district. And there's the ability to put together a very creative program of transition, given the right supports, and I think the regional center hopefully will be able to speak a little bit to that in California. But, you know, in our case, there was an opportunity to do some community college, there was work experience, there was ability to go in an apartment supported where they, you know, helped them get set up an apartment, helped them learn to cook, helped them live safely. All of that was part of that transition program from age 18 to 22. He did not go back to the high school to be with kids that were, you know, younger. He wasn't back in that high school building. The transition plan, the transition program moved from the high school building into a community plan. And that was, in our case, a very successful transition program.
Okay, on a different topic, are you aware of the 529A or in California it's called CalAble?
I can't say that I'm, you know.
Okay. It is taken out of, you can put 14,000 in, it's like a college savings.
Oh yeah, college savings fund,
but
yes.
But it's not college savings.
Okay.
It's for disabled, so it's called CalAble, and you can put 14,000 a year, up to 100,000. It doesn't go to that SSI test. So.
Right, and there's the ABLE accounts. There was a law that was passed through the Obama administration called an ABLE account where you can put money into that account, and it earns interest-free. So it's like an interest-free earning account for your child. That's a nice perk, and that doesn't count against the $2,000 SSI benefit. So that is a really nice law that passed.
How close to 18 should you start the whole process with SSI? I mean, I'm assuming you don't wait right until the date they turn 18, but do you start it when they're 17? Do you start it when the 6 months before?
I would say maybe 9 months before the senior year, you know, getting it in place. And I will warn you guys about something that has happened to me on more than one occasion at IEP meetings. So here's a scenario that just sort of broke my heart, and I really stepped in and through some strong advocacy made a big difference for this child. So again, I recommended the neuropsychological testing before graduation. The testing came back with an intellectual disability, IQ 65. At that point, there was not what they call guardianship for this child. This child was 18 years old. Technically, they're an adult in the eyes of the law unless you have guardianship. I am talking to the district about, well, what are you doing for the transition? We've got an intellectual disability. The adaptive scores are low. Where's the plan? So parent and I are all on board. Let's put together this big transition plan. They're going to stay in school 18 to 22. School district pulled the kid aside, who is an adult, and said, you want to graduate, don't you? You don't want to be here another 4 years. And the kid said, I want to graduate. I want to graduate with all my friends. I don't want to be here another 4 years. They didn't get any of the implication of signing on the dotted line. And I said, well, you can walk through graduation You can go through the ceremony, just get the blank diploma. You can still walk the stage, but we're going to do this for you afterwards. We're going to have all these programs in place. Pull them aside, the staff there, pull them aside, but you want to graduate, don't you? That was one of the few times at an IEP meeting that I really raised my voice at the staff. And I said to the staff, I said, you are adults. You want to do the right thing here. I said, this is unethical, what you are doing right now. You're taking a child with an intellectual disability. Parents do not want this child to graduate. You have an obligation to provide a transition program, and you are exploiting this family. Well, things turned around. The child didn't graduate. There was a transition plan put in place, and things ended on a good note. But this happens. And I have had that situation happen more than one time. So just be aware that if you don't have guardianship, and I'm not suggesting that you get guardianship, but be very, and in some cases it's important that you have guardianship. It's on a case-by-case basis. But be aware that on more than one occasion that staff may undermine what your wishes are, and your child's an adult. And there is nothing you can do about that if he signs. He's an adult in the eyes of the court.